Well, good evening, and thank you all for joining us for tonight's important conversation with Virginia's healthcare providers and our distinguished panelists. I want to start by thanking you all for the work that you and your colleagues have done to keep Virginians safe during this pandemic. As a doctor, I know that many of you have been on the front lines of this pandemic, risking your own and your family's health to keep other people safe. You're doing a tremendous service for your neighbors and your communities. And on behalf of Virginia, we are deeply grateful. We want you to have the most up-to-date information to pass on to your patients. That's why tonight's webinar is so exciting. I know you want to help your patients make the right choice to get vaccinated against COVID-19. Just over 60% of Virginians have had at least one shot, and 54% are fully vaccinated. But we want more people to be protected, especially as the Delta variant circulates. Virtually all of our hospitalizations and deaths from COVID now are among unvaccinated people. And I know we all share the goal of preventing unnecessary illness. Our panel tonight will include State Health Commissioner, Dr. Norm Oliver, Fairfax Health Director, Dr. Gloria Adeoyensu, and Southwest Virginia pediatrician, Dr. Erin Brickley. VDH's Dr. Chris Guyamegami will be our moderator. My thanks to all of them. I appreciate especially Dr. Oliver's tireless work to lead the Virginia Department of Health's pandemic response, while also overseeing all of the other responsibilities of our public health agency. And welcome and thanks also to our Secretary of Health and Human Resources, Dan Carey, for all he has done throughout the pandemic, while also overseeing other pressing health needs. I also want to thank our friend, Dr. Anthony Fauci, for joining us tonight. Dr. Fauci, you have been a steady leader during this pandemic, as well as over the course of your long career in public health, and we say thank you. Your dedication to science and service have saved countless lives. So again, we are so grateful for all that you do. And finally, I want to thank a friend to all of us, Dr. Danny Avula, who since January has served as our vaccination coordinator in addition to being director of the Richmond and Henrico Health Districts. Dr. Avula and his team have worked nearly round the clock to coordinate the complex logistics and relationships around vaccine distribution. And as you know, their work has paid off. Virginia has administered nearly 10 million doses of vaccine so far. Dr. Avula is also quite literally the face of Vaccinate Virginia and has represented us so well. As governor and as a fellow pediatrician, thank you, Danny, and I'll now turn this webinar over to you.
Thank you, Governor Northam, and welcome everybody. It has been just an incredible privilege to work with so many of you over the last 6 months as we've embarked on this really unprecedented campaign to vaccinate Virginia. And we've known since the beginning that healthcare providers would be at the very heart of this effort. And I want to echo everything that the governor just said and his thanks for the crucial role that healthcare providers across the Commonwealth have played and will continue to play as this vaccination effort wears on. I also really want to thank the professional associations who are now being shown on your screen under the video. They have sponsored tonight's webinar by promoting the event to their members and really appreciate their support. And those efforts have really been fruitful. We have had more than 5,000 healthcare professionals across the Commonwealth register for this event. And so lots of interest. For those who can't attend, or want to review the conversation again in the future, this recording will remain available at the same website that you've gone to, governor.virginia.gov/provider-webinar. And that interest was reflected in the more than 2,000 questions that were submitted in advance of tonight's webinar. Obviously, we can't get to all of those in the next hour, but we've really tried to tease through them and select some representative questions that Dr. Fauci and the rest of the panel can weigh in on. And so I really want to now introduce our star of the evening, Dr. Tony Fauci. Really needs no introduction. He has been the face and the voice and the leader of this effort nationally, the person that we have all looked to in so many ways. And Dr. Fauci, I got to tell you, one of the highlights of my pandemic experience what happened just last week. Last Wednesday, I was at the library leaving a meeting, and as I got into my car, a woman from across the parking lot was waving me down. And she pointed to the roof and she said, "Hey, you forgot your coffee mug." I had left it on top of my car as I got in. She handed it to me and she looked at me and she said, "You look really familiar. Are you Dr. Fauci?" I just said, "No, but that is the highest compliment you could possibly pay me." So Dr. Fauci, I just thank you for being a model of consistency, of clarity, of transparency for all of us through this pandemic. And thank you for being with us here this evening. I want to hand it off to you to open us up.
All right. Thank you very much, Danny. I would not have any problem people confusing me with you, so don't worry about that. It's a pleasure to be here. I just want to take a couple of minutes just to set the stage, because I know we have probably a lot of positive looking forward to the question and answer period. We all know that we are living through a historic period of one of the most devastating pandemics. In fact, the most devastating pandemic in the last 102 years, and maybe one of the worst literally in all of history. But we have a very important tool that we can counter this, a highly effective vaccine that is very safe. We are really very fortunate, unlike other countries, which would do anything for vaccines. We have vaccines more than we know what to do with. And right now it's our job to make sure we can get as many people vaccinated as we possibly can. We have 93 million people in this country who are eligible for vaccines, who are not vaccinated right now. And it's up to all of us here. And particularly, I'm very pleased to congratulate the governor and the people of Virginia and your health authorities for the effort that you've put in to get as many Virginians vaccinated as possible. And you heard from the governor that 54% of the entire population is fully vaccinated and 60% of the people have had at least one dose. We're going to do better than that, and we're going to continue to improve and get people of Virginia safe. So I'll stop right there, Danny. I'd be happy to answer questions. I don't want to take too much time.
No, that's great, Dr. Fauci. Thank you. So, let's just start with the basics. I mean, so many of the healthcare providers on here all day, every day are seeing patients who are concerned about the safety of the vaccine. So given this whole journey, what advice, what guidance would you give to providers who are really trying to reassure patients around safety, around their effectiveness, around where they develop too quickly, and that we haven't had enough time to study the long-term effects?
Well, Danny, there's an answer to all of that that's scientifically based. First of all, people might understandably say, you first recognized the vaccine, the virus in January of 2020, and 11 months later, you say you have a highly effective vaccine that you're putting into the arms of individuals less than a year. What is lost on the public is that 20 years of research, fundamental, basic, and clinical research on the mRNA technologies, on the other vector technologies, on the immunogen technologies, antedated the work that started on January 2020. So this was not rushed at all. This is the fruit of major investment in biomedical research. Next, the vaccine was tested in studies that range from 30,000 to 44,000 people in each trial. And the vaccine has now been given to hundreds of millions of people throughout the world. The real world efficacy remains extremely high, particularly against hospitalizations and death. And the safety data are as good as you can get. There are always some adverse events with any intervention. But when you match the benefit of vaccination against the very, very unusual risk of an adverse event, we're dealing with vaccines that are highly effective and very safe. And the scientific data absolutely prove that.
So the news of this past week has really been variants, and in particular the Delta variant. So what do providers need to know about what the Delta variant is, how it's impacting the United States, how our vaccines are working against that variant, and how can they reassure their patients in the midst of this?
Well, here are the facts about the variant. It's a formidable foe, Danny, because the Delta variant transmits much more efficiently than the Alpha variant and that other variants that we've seen. There's no doubt about that. It is a highly efficient transmitter. The other thing that we know is that our vaccines do very well, even against the Delta variant. The protection against initial infection is a bit less. It goes from around 95% down to, about 80 some odd percent. But the thing that holds true for sure is the very, very good protection against hospitalization and death. So if you're asking the question, is the vaccine doing the job we asked it to do, namely protect me from getting sick? The answer is a resounding yes. If you look at the deaths of COVID-19, 99.5% of them are among unvaccinated and only 0.5% among the vaccinated. The one thing that is different is that when you get infected with the Delta variant, the amount of viral load in your nasopharynx is about 1,000 times higher compared to other variants like the Alpha variant, which explains why it's more easily transmissible. That is an important issue because vaccinated people now, we know they can get breakthrough infections. Why? Because no vaccine is 100% effective. But the thing that's different is that when vaccinated people get infected, even if they have no symptoms at all, the level of virus in the nasopharynx is equivalent to the unvaccinated person, which means vaccinated people can and do transmit when they get a breakthrough infection, which is the reason for the changing of the CDC recommendations about wearing a mask when you're in an indoor public setting in an area of high viral replication, namely a red or an orange zone, even if you are vaccinated. That is the reason for the change in the recommendation.
Thanks. And you mentioned breakthrough infections, and I think the outbreak in Massachusetts really, and along with other data that we've been gathering in the last few weeks, has really given us more clarity into what we're dealing with this Delta variant. Can you talk a little bit more about breakthrough infections, how common they are, maybe reiterate some of what you said about the impact and protection that vaccines offer against that?
Yeah. So we want to make sure when you talk about a breakthrough infection that ultimately makes you seriously ill, if you are vaccinated, it is overwhelmingly clear that the vaccine protects you from serious illness that might lead to hospitalization. That still holds very strong, 90, 93, 95%. You're in good shape. With regard to the Delta variant, one of the things we don't have hard data on is the number of people that get asymptomatically infected. We know that when you're talking about symptomatic infection, it protects you to the tune of about 80+%, which means that there still is a very low chance you're going to get infected to begin with. but a really, really good chance that you're going to be protected against severe disease.
And a follow-up on that, do we have much of a sense of that efficacy or the breakthrough infection rate with the different vaccine types?
You know, we don't have as much data at all in our country with J&J because we have, 60% of the population has been fully vaccinated. There have been well over 180 million vaccines that have been administered, but we only have 18 million J&J. So the overwhelming amount are the mRNAs. And we know that Pfizer parallels very much Moderna. The data are almost the same for each. We don't know enough about the data for J&J. We do know that it protects against severe disease, but its protection against symptomatic infection is somewhat less. It's still high, but it's somewhat less than the Moderna and the Pfizer.
So, one of the most common things that our providers are hearing from their patients about why they're not getting vaccinated is that they are concerned that it's still under an emergency use authorization and they're waiting for whatever confidence or reassurance comes with full licensure. Can you talk a little bit about what the EUA means versus a biologic license and how providers should couch that for their patients?
Yeah, that's a really great question. And I do hope when the vaccine gets full approval that we will see a surge of people getting vaccinated. An emergency use authorization, by its strict definition, the criteria for an EUA is the following. You have to have a product when you're in an emergency and the benefit appears to be greater than the risk, which is not a very high bar, as it were. But if you look at what actually has happened with these vaccines, the efficacy is overwhelmingly clear in hundreds of millions of people being vaccinated and maintaining good protection. The safety profile is very clear. So although we don't have the technicality of a full approval, what we do know about these vaccines is overwhelmingly more than what we know about most products that are under emergency use authorization. Put another way, to be really clear, Danny, that I would be astounded if this did not get full approval. So it's almost as good as there. It really is the FDA having to go through their independent process of dotting all the I's and crossing all the T's. But this is a very, very effective and very safe vaccine.
Any sense of where we are on the I dotting and T crossing? Any indication of how much longer before that licensure happens?
Well, one thing we don't do is you never want to get ahead of the FDA because they need to function as a completely independent agency to maintain the confidence that the public has in them. But my hope, Danny, my hope, not my prediction, but my hope is that we will see a full approval before we get to the end of August.
All right. Well, another huge category of the questions that providers submitted were around the concept of boosters. So I think there's a segment of that is, what do we know about the length of vaccine efficacy in the patient population who has been vaccinated? What does that mean about the potential for boosters, and differentiate kind of the boosters with the existing vaccines versus the development of boosters that may incorporate variants as well?
Okay, a bunch of very good questions. I'll try to succinctly answer them. When you look at people who might need, quote, a booster, I think you have to look at it in at least two separate categories, because there are those individuals who are immune compromised, transplant patients, patients on cancer chemotherapy, patients on immunosuppressive regimen, for example, for autoimmune diseases. Those individuals we know almost invariably do not have an adequate response. So the need to give them an additional boost is much more emergent than the general population. So we are trying very hard to get the regulatory mechanism in place very soon to get those individuals a boost that might bring up their immunity to the level where it should be if possible. That's a different story than asking a normal, healthy person or an elderly person, do we have enough information now to say we should be boosting them tomorrow or next week? And the answer is no, we don't think they need it right now. But the CDC and the companies and our own clinical trial apparatus literally on a weekly basis are following this to see if the durability of immunity wanes. It looks like from Israeli data and from some of the data that Pfizer has, that over a period of months, it does wane. We're looking at that very carefully, literally on a weekly basis. And as soon as it looks like there needs to be a booster, we are already prepared to give a booster because we've done the clinical trials to demonstrate the type of increase you get with a boost, as well as the safety associated with a boost. Bottom line, we're ready for it if and when it occurs.
All right, next topic. Schools have obviously been in the news a lot, particularly with the updated guidance from the CDC last week. What do providers who, particularly those who are seeing children or parents of children, how do they reassure parents around what Delta in particular means for kids and what needs to happen over the next weeks and months as we head into school opening?
Well, Delta is a highly transmissible virus. The best way to protect children is to surround them with people who can be vaccinated and are eligible. Children from 11 and younger right now are not eligible for vaccination. You protect them two ways. One, you get as many people who surround them vaccinated. And number two, when they are in situations where they might be exposed, such as in the schools, you have them wear masks. And again, that's the fundamental reason for the CDC guidelines that local districts should seriously consider having a mandate for everyone in the school system to wear a mask, whether they're vaccinated or not. We must get the children back to school in person in the fall. The deleterious consequences of keeping children out of school, we know now from a 1.5 year experience, is a profound problem. We've got to keep them in schools, but we've got to protect them when they are in school. And that's the reason to keep people who are around them vaccinated and to get them to wear masks in the school system.
So I think the argument for mask wearing, particularly for younger kids, is pretty obvious. They don't have the opportunity to be vaccinated yet. And you spoke to this a little bit earlier, but I think it bears worth repeating because a lot of patients are asking the question: if I'm vaccinated or if my older child is vaccinated, why do we still need to wear masks? Why would we head that way as we open up schools?
Well, it's to protect others. So since no vaccine is 100% protective, and we're dealing with a Delta variant, which I just mentioned, when it does infect a vaccinated person, the level of virus in the nasopharynx is as high as it is in an unvaccinated person, which means if you're vaccinated and you get an infection, even if you get no symptoms, you can transmit it to other people. And we have documented cases where that occurs. So the wearing of the mask is an interesting connecting of the dots. It's to prevent you from getting infected so that you don't infect someone, for example, in your own household, like an unvaccinated child or an elderly person or someone with an underlying condition. So it's obviously to protect you, even though the chances of your getting a severe outcome if you're vaccinated is very, very, very low. But what you also want to do is to not allow you to inadvertently transmit the infection to someone else, including someone in your own household. That's why you need to wear a mask.
So while we're on the topic of kids, what do our providers need to know about the prospect of vaccine approval for kids under 12?
Well, we've already been doing the clinical studies on what we called age de-escalation. We study children for safety and immunogenicity from 11 years old to 9, then from 9 to 6, then from 6 to 2, and then from 6 months to 2 years. We are collecting data that very likely by the fall, we will have that data. The only issue is, Danny, that it then becomes a regulatory decision. What is the mechanism that the FDA will use to get those children vaccinated? Will they extend the EUA? Will they wait for the BLA or the full approval? Or will they have a separate mechanism? We don't know that right now, but that's going to be left up to the FDA.
All right, with our last couple of minutes here, Dr. Fauci, on my way into the office this afternoon, the security guard said, "Doc, are we gonna have another lockdown?" So pull out your crystal ball and give us some insight into what you expect the rest of this year and next year to look like, maybe as it relates to lockdowns, but just really your best guess at how this pandemic continues.
I don't see a lockdown in the future for the following reason, because despite the fact that we still have 93 or so million people who are eligible to be vaccinated that aren't vaccinated, we vaccinated a lot of people. We have 60% of the entire population is fully vaccinated. 70% of the adults have at least one dose. And we have between 80 and 90% of the elderly vaccinated. So I don't think we're going to see the type of surge that would require lockdown. If we get the majority, the overwhelming majority of the people who are unvaccinated, vaccinated, we're going to do real well. If we don't succeed in getting the overwhelming majority of the population, we will have smoldering infection that will prevent us from getting back to normal. In other words, people doing things the way we did before. It'll be kind of a chronic low level of infection dominated by the unvaccinated people. So that's the reason why we want to get people vaccinated, because we want to protect the unvaccinated now, to get them vaccinated so they don't get sick and get hospitalized. But we also want to crush the transmission of the virus so all of us can get back to normal in school, at work, in entertainment, in everything we do. That won't happen unless we maximally utilize vaccination.
Well, Dr. Fauci, I can't thank you enough for being here with us tonight, for taking time for the providers of Virginia, and for everything that you have done and been for this country through this pandemic. We know you've got to move on to your next event, and so we will thank you and say goodnight to you, and we will shift to the second half of our discussion. Thank you so much.
Thank you very much for having me, Danny. Thank you, Governor. I appreciate your hospitality. Thank you.
All right, I am now pleased to introduce my friend and colleague, Dr. Chris Guyamagami, known to many as Dr. G. He is a former chief medical officer and interim CEO at the University of Virginia, currently serving as a professor of emergency medicine there. But he has also spent a bunch of his time, I don't know how he juggles all these things, but really helping with a lot of different aspects of Virginia's COVID response, everything from helping design our efforts around case investigation, containment. He's really driven forward our work around monoclonal antibodies, and he's been my right hand on a lot of our vaccination work. So Chris, thanks so much for everything you have done, and thank you for being here tonight. And I'm going to hand off to you for this next segment of the panel.
Great, Danny. Thank you so much for having me, and it's been wonderful working with you and VDH and being part of this team. So tonight, we really want to focus on our audience, our healthcare providers. As Danny said, we've got several thousand in attendance, and we received over 2,000 questions. So I'm honored tonight to be joined by 3 colleagues from around the Commonwealth, and each will provide their perspectives on the challenges we currently face. And then we'll pose questions that we've received from our audience. So our first panelist is a familiar face, Dr. Norm Oliver. As the State Health Commissioner, Dr. Oliver is the Chief Administrator of the Virginia Department of Health. His varied career has seen him practice family medicine everywhere from Virginia to rural Alaska. He's taught at the University of Virginia and performs research into health inequities. He continues to lead the work to understand the roles of racial discrimination, bias, and prejudice in the propagation of these inequities and to create interventions to help reduce or eliminate them. So welcome, Dr. Oliver. We'd love to hear your opening thoughts.
Thank you, Chris. Can you hear me okay?
Yes.
Wonderful. I'd like to welcome everyone to this webinar and thank you for joining us. I believe that the Virginia Department of Health has been a real force here in this Commonwealth under the leadership of the governor, the secretary, Danny leading the way on coordinating our vaccination campaign and ensuring that we could get this some 10 million doses of the vaccine administered across the Commonwealth. We've been able to do that by multiple channels, and Danny could probably explain this much better than I do. And one of those channels, of course, is the providers, both those in hospital systems and those who are community-based. So thank you for joining us and trying to help us think through ways of improving how we can get more vaccines administered through that channel. There's been other channels, of course. The health department in particular has been focused on really targeting hard-to-reach communities and rural areas in Black and Latinx communities and other communities of color around the Commonwealth. We have also been working with our partners in the community-based pharmacies. Most of the vaccines now are being administered through that channel. It takes multiple different channels to do this. In addition to the ones I just mentioned, of course, we have the healthcare systems around the Commonwealth who have really helped. It's that kind of unified effort across multiple institutions and communities, and both at the local level, at the state level, private and nonprofit organizations, faith-based organizations, and others really working together to make this happen. We've been proud to be part of this effort, and I'm happy to be here to have an opportunity to answer some of your questions about the challenges that we face in doing that. Thank you, Chris.
All right, great. Thank you, Dr. Oliver. Such a great recognition. And I would also add that there's been such great work from the Free Clinics Association, as well as our federally qualified health centers. So any of those who are in attendance today, thank you so much for all the great work in helping to reach out to our underserved. So our next panelist is Dr. Gloria Adeoyensu. Dr. Gloria, as she's known to those who she works with in her community, is the director of the Fairfax Health Department. Fairfax Health Department is a beast. It's got an annual budget of 70 million. It has 600 full-time staff. It's the largest health district in Virginia. And Dr. Gloria has really focused on the diverse ethnic and cultural and economic backgrounds of the people there. She also serves, in addition to her full-time duties as the health director, as the outreach coordinator for the Vaccinate Virginia campaign. So welcome, Gloria. I'd love to hear your thoughts.
Yeah, thank you, Chris, and welcome everyone. I really appreciate this opportunity to participate in this forum. You know, at the health department, we often refer to public health as a team sport because it is what we do together as a society to create the conditions in which everyone can be healthy. And if there's one scenario that exemplifies this concept of everyone coming together to create healthy and safe communities for all, it is this pandemic. Right from the start, all the public health interventions recommended to limit transmission have worked best when everyone in the community is doing their part, from hand washing to testing to isolation and quarantine to masking and now vaccination. As you all know, the vaccines we currently have are the best tools we have for ending the pandemic. And the goal is to achieve herd immunity. In the Commonwealth, our approach to herd immunity is not necessarily reaching a certain percentage, which is important, but also ensuring that we're able to achieve the highest level of immunity within every segment of our diverse communities. So although, for example, in Fairfax Health District, over 76% of adults, for example, have received at least one dose of vaccine, our work is far from over because vaccination rates across the county is not uniform. And this holds true throughout our state. So the Virginia Department of Health, as you've heard, has created an outreach task force to assist local health districts develop a more sustainable and scalable approach to community outreach and engagement. This is really an all hands on deck effort to engage with trusted community influencers who can help public health in communicating our messages, as well as better understand and address the lingering issues that continue to fuel vaccine hesitancy among some of our residents. And, as vaccine has become more available, health departments have shifted their strategy and are bringing vaccines closer to the community. We're going to community events, we're going to churches, we are organizing mobile clinics and so on and so forth. However, to be successful, we need strong community partnerships, which is why we are expanding our outreach to engage with non-traditional partners such as barbershops, apartment managers, and so on, while we also continue to work to strengthen our traditional partnerships with people like you, our healthcare providers. We appreciate the long-standing partnership that we have enjoyed with you, and especially the role that you have played in helping us move quickly through our vaccination registration queues during the early phase of our vaccination campaign. But if I may make one more request of you before I end my remarks, it is that you use every opportunity that you have with the patient to not only talk about the vaccine, but ensure that anyone who wants it gets it before leaving your office so that the opportunity to vaccinate is not missed. Thank you.
Great. Well, thank you, Dr. Gloria, for those comments. I think everybody in the audience should just be aware that she's been not working just in Fairfax, but all across the state to educate and facilitate those types of connections. So everyone here, and just know that you have a local health district with leadership and resources that you can reach out to help with this community engagement. So our last panelist that I'd like to introduce is Dr. Erin Brickley. And I'm really looking forward to hearing from Erin because she is a frontline practicing physician with Mountain View Pediatrics in Marion, Virginia. As a rural pediatrician in Southwest Virginia, Dr. Brickley works every day to address parents' concerns about vaccinating their children and themselves. So we're really anxious to hear about your insights and experiences. So welcome, Dr. Brickley.
Thank you, Chris. Thank you for having me. I appreciate the opportunity to represent Southwest Virginia and the rural medicine population across Virginia. Rural medicine is very rewarding, can be lots of hard work. And unfortunately, adding a pandemic on top of regular rural medicine has added new challenges, not only just in medicine, but in vaccination as well. At the beginning of the pandemic, we realized how many of our patients lacked transportation, lacked basic medical needs, lacked internet sources as we were trying to set up telehealth medicine appointments, working through well checks and just regular standardized vaccines. Unfortunately, we have also noticed that a lot of our families learn from word of mouth. So they trust their friends, neighbors, pastors versus trusting science and trusting their physicians. A lot of our parents do not have a primary care physician. They use the ERs or the urgent cares for their medical needs, and that has added another layer of misinformation on top of everything else. Unfortunately, a significant portion of our population does not believe in COVID, does not believe in testing for COVID, refuses isolation, will fight us over just a swab of the nose for their child. And so that's added another layer of concern across our population. With the vaccine, that word of mouth goes a long way. When we have our patients come and they ask us about vaccines or we ask them about the COVID vaccine, we hear all kinds of misinformation. Every day we hear myths, facts, things that parents may think are true that are not. The biggest ways that we have overcome those challenges is by vaccinating in our office. So we've been working successfully with the health department. Fortunately, they've been giving us support. And we are able to vaccinate not only our 12 to 17-year-old patients, but also their parents, family members, and regular people who just live in the population in the area. We found that our parents trust us as pediatricians to give vaccines versus trusting their knowledge of others because we give their children regular vaccines. So that's really helped us make that connection with our parents. We've found that using an open line of communication, using our motivational interviewing skills, which we apply to our teenagers at every well check, has helped also with our parents change minds. But we also have recognized that sometimes we just are there to give information and we can't sway minds. So we have to really read the room to determine, is this going to be a success or not? Fortunately, we're already starting with our school physicals for the summer, talking about vaccines for younger children with our parents. So we're hoping to keep those lines open to be able to successfully vaccinate children ages 11 and under once able. We've been able to vaccinate about 200 12 to 17-year-olds in our office themselves. And then we do have a lot of use of community pharmacies as well, which has been very helpful to get our kids vaccinated. So it's just all these different layers of being pediatricians and now having to do some adult medicine as well. But it's been grateful every time that we're able to vaccinate patients or get them scheduled for their vaccine.
Well, Dr. Brickley, kudos to you and your team for really tackling what has turned into one of the most difficult and challenging parts of this pandemic response. So thank you so much. And we'll circle back into some of these topics as we get into the questions. So we do have a few minutes for questions. We have tried to consolidate the questions down because we received almost 2,000 of these. So we're trying to bring themes, but these were actual submissions from our audience. And so we're going to go around the horn a little bit here. So we'll start with Dr. Oliver. And you mentioned a little bit of this in your opening comments, but can you comment a little bit on what some of the barriers to vaccination and really healthcare in general are that face our historically underrepresented and vulnerable populations? And what is it that our audience as healthcare providers can help to improve things now?
That's a really important question, Chris. The communities of color, and I would also say rural populations, are particularly vulnerable for a whole host of reasons. For example, in this current pandemic, people in Black and Brown communities throughout the Commonwealth tend to be concentrated in so-called essential industries. If you look at who's behind the counter in the grocery store, who's working in the construction sites and so on, you'll know what I mean. And that puts them in the situation of being out front and facing the virus every single day. These communities have also been the brunt of inequitable treatment throughout the long history here in the United States, which has resulted in an extra burden of chronic diseases from hypertension to some cancers, stroke, and many other things. And these chronic conditions put them at higher risks of having more serious impact from COVID-19. They also lack insurance coverage in many instances, although thankfully here in Virginia, more than 450,000 people have gotten insurance through Medicaid expansion, which was a really great help. But that being said, there's still challenges in that front, and that leads to a decreased access to care. These things are all barriers that have been challenges in our being able to fully vaccinate these communities. And we understood this from the very beginning. And for that reason, incorporated into our general approach to first testing and then vaccinating people in the Commonwealth, having a health equity working group that could really help us to target these communities and ensure that we had equitable vaccination in those communities. And I think we've made a lot of progress in that regard, doing this sort of targeted work that Dr. Gloria mentioned in her opening comments, really working with trusted community leaders, faith-based leaders in those communities, and so on. Dr. Brickley mentioned this as well. When in rural communities or in these communities of color, if you have those trusted individuals around who are also ambassadors for vaccination, that helps to get those people vaccinated. And if you go to our website and look at the distribution of vaccination, you will see that we are vaccinating the Latino population in the same proportion, a little bit more than we are others. Likewise, with the African-American community, we started out not being able to vaccinate that in the same proportion as the rest of the Commonwealth, and we've moved up to and are approaching parity in that one as well. And we're doing much better in the Asian American community. So I think that for the providers who are here on this webinar, that the most important things that you can do right now is to do, as Dr. Brickley talked about, using your practice to reach those vulnerable populations who come to you as a trusted provider for them and their families. As a trusted provider for those people, I believe that community-based physicians and physicians and other clinicians in general are trusted beyond just their own patient panel. I think that just being a provider who's on the front line dealing with this pandemic gives you some moral suasion, I guess is what I would call it, in the community at large. And you should use that. You should go out into your community and speak about the importance of getting vaccinated and help to educate people on this. I think that for the African-American community, other communities of color, rural populations, that the biggest impediment outside of access is the lack of really good information to counter the misinformation that's out there. And you can play a huge role in beating that back. So thank you in advance for doing that.
Well, great. Those are great insights into some of the big challenges. And, you know, if anybody didn't believe the disparities were there before the pandemic has clearly peeled off the veneer, and we've seen those front and center. So along the lines of that influence, Dr. Gloria, we've heard Dr. Oliver now talk about healthcare providers using their voices, using their influence. When it comes to vaccination, what type of outreach are most effective for healthcare providers? What can they do with the local community with faith-based organizations or others to energize and motivate towards vaccination.
Thank you. So, one of the things we're learning from people who are waiting to get vaccinated in terms of who some of the influencers are family members, friends, and their private doctors. We've always known that patients trust their providers. And so, it makes providers even more special in terms of our outreach efforts. We do need our providers, and there are many opportunities for our providers to engage in outreach, starting with when the patients come to their to their offices and so on, but also partnering with health departments as we move forward with our engagement activities. We will be calling upon our providers even more so, so that they will be able to join us in our efforts. But basically, any opportunity to talk about vaccines, to ask the question, and especially for providers, it is not going to be so far-fetched, because we're used to our providers asking us questions about our health, and so. I think providers have a very unique opportunity to kind of, be out there and ask questions, and then be able to provide the answers that may still be lingering on the minds of people within our community.
No, I think that's a wonderful suggestion. And we have time for just really one more. And I wanted to get with Dr. Brickley because truly, as a frontline provider, I think that the question that was probably the most common one that we got was really what works? What approaches will work best for you when you're discussing vaccines with hesitant or even resistant friends, family, patients, and even other healthcare colleagues?
Mm-hmm. So I think that communication is key in this. As I kind of mentioned before, we often read the room in pediatrics, especially. We watch, development of children as we're doing our exams. So we've just kind of adapted to feel how the patient is and the parent, for that matter. We've started asking at every visit if the parent is vaccinated, if their family is vaccinated, or if the child is age appropriate, if they're vaccinated. And that seems to then open the door for questions, concerns, myths, whatever families may be worried about. So I think that the biggest thing that's probably worked is just trying to be truthful in our answers. That we do recognize that there are unknowns, that we only have a year's worth of data, things are there, but that the benefits outweigh the risks. A lot of times we rely on the fact that the parents can then protect their children by protecting themselves. And so that helps as well. Myths, I've kind of collected just over the last week, things that we've heard, concerns about sexual function and fertility, concerns about, I think somebody mentioned at the beginning, a tracker being put in the arm, or that I'm now a magnetic field from being vaccinated. Concerns just about, well, what about the long-term effects? Is this going to protect me forever? Will I be vaccinated and protected? Why is it not 100%? Things that we hear on a daily basis. And so we're just truthful in our answers. A lot of times we do recognize if a parent is becoming raised, we try and remain focused, answer their question. But if we need to move on from the conversation, then we move on from the conversation, because that rapport, we want to keep that rapport with our patients. And I think that, some successes that we've had, a big thing that families have mentioned is concern that the vaccine is so new. And as Dr. Fauci mentioned earlier, the data and the technology has been around for 20 years, and most parents don't realize that. So I've had several families just in the last week that have scheduled or gotten their vaccine in office after we've talked through that. So it's just knowing your patients, knowing your patient population. In rural medicine, we face a lot of misinformation. And so that's really helped, on a day-to-day basis. And then the fact that we vaccinate parents, a lot of our parents are appreciative of that. We've had several families that have waited to get vaccinated until they can get vaccinated at our office because they trust us. And so if you're not doing that in your practice as a provider, I'd recommend linking with the local health department or vaccine distribution to get vaccine in the office. But it's just been communication, listening skills, knowing when to stop, knowing when to keep pushing, knowing when to be a little pushy. And all of those things have led towards our success in vaccination.
Yeah, I think that you give great examples of how you can take advantage of that existing relationship and the respect that your patients have for you. You're probably one of the few sources of knowledge that they truly will trust and will listen to a little bit objectively. And like you said, it may take more than one swing at that to convince them, but staying engaged and keeping that relationship, more power to you, and thank you for everything you're doing. Well, we're about done with our question time, and I just wanted to thank everyone on the panel for being with us tonight, and also to thank our audience for being engaged after probably a long day at work. I want to highlight a couple of things. We have some great sponsoring professional associations that have supported our effort here and tried to get the word out. And we've recorded this so that if you want to share it with your colleagues, that'll be available. If you scroll down on the page, there's links to the recording, but also resources that will help you if you want to host your own teletown hall. If you think this format could be helpful, VDH, we're willing to support that for you as well. So with that, I'd like to now turn it over to Virginia's Secretary of Health and Human Resources, Dr. Dan Carey, for some closing thoughts.
Thanks so much, Dr. G. Thanks so much to everyone attending tonight. I think the theme that I heard again and again was that word trust. And the first part of our vaccine program was when we had very limited supply and great demand, and it was more of an industrial delivery mechanism than clinical medicine. But that switch turned a number of months ago, and I'd like to mention a second word, and that is optimism. We're asking you to stay optimistic, to use the trust that we clinicians earn every day. And when you go tomorrow or tonight, if you're going to see patients tonight, in the room that I call the room where it happens, where we turn strangers into trusting fellow human beings that we're collaborating with, that we're partnering with for their health, and use that trust that you earn every day. Continue to be optimistic. We're depending on that to help us get through to those that are still scared, still resistant, still feeling vulnerable and hesitant. And I know that we together can meet those needs and vaccinate more Virginians, because unless we do, we're gonna stay unsafe until we're all, none of us are gonna be fully safe until we're all safe. So again, thank you so much. Stay optimistic, stay engaged, and we so much appreciate what you do for Virginians every single day. And I'll turn it to the governor for their final remarks. Thank you.
Thanks, Dr. Carey. And wow, what a great discussion this was this evening. And I hope you found it to be the same. And what a privilege it was to have Dr. Fauci. I think he's a household name and figure now, and he's really been working diligently to put this pandemic in the rearview mirror. I just wanted to take the opportunity, first of all, to thank our panelists. The insight that you brought tonight and the knowledge and answering these questions is really, really helpful. And most importantly, I want to thank all the folks that are part of this webinar and that have taken time out of their busy schedules to participate. You have literally been in the trenches now for 15 to 16 months, and I know you're tired. A lot of us that are on the panel tonight are physicians. We have been in the trenches as well. But I just wanted to reiterate that the vaccine is the answer to putting this pandemic in the rearview mirror. And statistically, about 98% of those that end up in the hospital or unfortunately die are unvaccinated. And the point was also made that this technology, this science has been around for over 20 years. So we feel confident that this is the answer. And, from the start of this pandemic, we have tried to give accurate and updated information. We have followed the science, And I think it was said earlier, this is a team effort. It takes a village. And I just want to thank all of you for being part of that village. And, you know, keep your energy up, keep your optimism up, your hope up. We still have work to do.